So this exercise can be for someone who has low back pain, but this is called pelvic rocks. So a lot of the times you can either be in more of an anterior pelvic position or a posterior pelvic tilt position. A lot of the times in the normal population, people will have this anterior pelvic tilt. So you want to try and find a neutral position. So for Sam, we're going to think if he were to have belt loops around his belt line, he wants to try and think of putting them towards the back of the room. So rather than trying to think of like, oh, squeeze your abs or think of your low back going onto the floor, we want to think of this other cue of putting your belt loops towards the back of the room. So for Sam, he's going to think of that exact cue and think of that tilt under, perfect. And then I'm just going to go in the complete opposite direction. So think of completely letting this relax and even creating that little bit of the space here, perfect. That's the anterior tilt. And I go in the opposite position for that posterior tilt. Good. And then again, reverse to the opposite. So this is great to just find what range of motion you currently have with your pelvis. And you can do about 8 to 10 rocks each way for 2 sets.